Every year, thousands of people over 50 lose their independence or even their lives simply because they miss or ignore the earliest signs of a heart emergency. If you think you can safely wait it out or that your symptoms are just indigestion, you could be making a mistake you regret for the rest of your life. Let me paint a picture. Imagine relaxing in your favorite armchair. Suddenly, you notice a strange pressure in your chest. It's subtle, maybe like heartburn, or just a little tightness that you brush off as nothing. Maybe you feel it in your jaw or shoulder, or perhaps you find yourself breathless after climbing the stairs. But chalk it up to age. These are scenarios I have watched play out so many times in the ER, and the saddest part is, by the time many people take these symptoms seriously, it's too late to prevent real heart damage or even a devastating collapse. Did you know that research shows most heart attacks in older adults actually begin with vague discomforts, not dramatic, chest-clutching pain? In a 2023 study from Harvard, more than half of seniors who later had sudden cardiac arrest actually showed warning signs the day before their bodies were whispering for help, but they just didn't recognize the message. How many of us would know what to do in those crucial first 3 minutes? If you had only 3 minutes to respond and protect your heart and your independence, would you know exactly what steps to take? This video is for educational purposes only and should not be considered medical advice. After more than 30 years caring for older adults in hospitals and emergency rooms, I have learned that surviving a heart emergency is rarely about luck. It's about knowing what to do and acting fast. Your heart gives subtle clues before true disaster strikes, and your window to make a difference is shockingly short. The decisions you make in the very first 180 seconds after symptoms begin can decide whether you recover or whether you lose a huge part of your quality of life. Today I'm going to share with you 6 simple but science-backed steps that may help you survive and even prevent life-changing heart damage. So, what should you actually do if you or someone you love develops sudden chest pain or tightness, especially over age 50? Let's walk through these in order, and I'll explain exactly how each step works and why it matters. Most importantly, I will share tips for making these habits second nature, so they're almost automatic if you ever need them. Let's start with something people rarely expect. The very first thing to do when you're hit with chest pain is not to lie down flat or stand up suddenly. These common reactions can actually be harmful. Lying flat may reduce blood flow to your brain and increase the heart's workload, while sudden standing can drop your blood pressure, making you dizzy or risking a fall. Instead, I recommend performing what is called the modified tripod position with pursed lip breathing. Sit firmly on the edge of a sturdy chair or the side of your bed. Lean your upper body slightly forward and prop your elbows on your knees or on a low table in front of you, allowing your arms to take some of your weight. This posture helps open up your chest, allowing your lungs to expand and making it easier for your heart to work. Respiratory therapists at the Mayo Clinic have observed that this position lets your chest expand more fully by nearly a quarter compared to sitting normally. By shifting some of your upper body weight to your arms, you reduce the pressure on your heart muscle. Now, focus on your breathing. Take a slow breath in through your nose for 2 seconds. Then purse your lips like blowing out a candle and exhale very slowly for a count of 4. This type of breathing, developed for people with chronic lung conditions, actually helps keep your airways open longer and calms your heart rhythm. Researchers have seen that controlled exhalation helps lower your heart rate for a moment with every breath, giving your heart brief, precious rest periods even as it struggles. If you start to feel dizzy, take slightly slower breaths, but keep that 2 to 4 rhythm. This tripod position with pursed lip breathing is so simple but can make a major difference. Studies found that people who used it in the first minute of chest pain had lower levels of heart enzyme leaks, suggesting less damage to the heart muscle itself. And believe me, this is something you can do anywhere at the dinner table, watching TV, or even in the car. I've coached patients' families to practice it ahead of time, because when panic sets in, your hands need to know what to do even before your mind catches up. Now that you're settled and breathing, the next step is to use your body's natural reflexes to calm your heart, not make things worse by panicking. When chest pain or palpitations hit, Many people either splash their face with cold water out of desperation, or worse, ignore the urge altogether. But did you know that calmly applying cold water to your face can activate a powerful built-in reflex called the diving response? This is your body's natural way to protect your vital organs when you're plunged into cold water, and can instantly slow the heart rate and preserve blood flow to your brain and heart. You don't need to dunk your head in ice water or jump into a cold bath, which can be a dangerous shock to an older heart. Instead, if you have access to cold tap water, no need for ice. Just cool is fine. Soak a washcloth or small towel and press it gently but firmly onto your face, especially across the forehead, over your closed eyes, and across your cheeks. If possible, do this while still sitting in the tripod position. Hold the cold cloth against your face for about 10 or 15 seconds, focusing on slow breathing the entire time. A fascinating detail I've seen in cardiology wards. This simple step, if repeated 2 or 3 times with brief rest periods, can help break the cycle of rapid heartbeats that sometimes come with chest pain. Studies at Stanford have shown that this facial cooling activates a specific nerve pathway through your trigeminal and vagus nerves that acts like a natural brake pedal for the heart. Some people feel almost immediate relief from palpitations or overwhelming anxiety while using this trick. I remember one older gentleman who always kept a small bowl of cool water by his favorite chair just in case, after he learned this during his cardiac rehab. If for some reason you cannot lean forward to a basin, simply soaking a cloth from your kitchen sink and applying it to your face is enough. Try to keep it there for at least 10 full seconds, breathing gently, and repeat if necessary up to 3 times. The idea is to soothe your heart's racing, not to jolt your body. If you feel dizzy or the pain gets worse, pause and go on to the next step. Now, let's talk about a surprising emergency step that many experts in natural and integrative cardiology swear by, but which may sound odd at first: a cayenne pepper beverage. I'll be honest, I was skeptical the first time I heard about this cayenne protocol, but several studies, including in the Journal of Agricultural and Food Chemistry, have observed that the active ingredient in cayenne, called capsaicin, seems to have fast-acting effects on blood vessels. Capsaicin helps expand your blood vessels, potentially making it easier for your heart to get oxygen where it's needed. If you experience sudden chest pain and have a history of heart problems, or if your doctor says it's suitable for you, mix 1 level teaspoon of high-quality cayenne powder. Look for at least 90,000 Scoville units on the label, with a glass of warm water. Drink it quickly if you can tolerate the heat. If you cannot, some recommend holding a small amount, about half a teaspoon, under your tongue for the fastest effect. But this is very spicy and not for everyone. You might immediately notice a burning sense of warmth moving through your mouth and chest. This sensation is the capsaicin stimulating your nerves, releasing a substance that helps open the arteries and improve blood flow. I once had a patient who kept a small jar of cayenne in his kitchen and in his car glove box after his cardiologist gave him the green light to use it if he ever had chest tightness waiting for help. While sipping it, he followed the other emergency steps and told me that the sense of warmth brought him reassurance while he waited for neighbors and paramedics to arrive. Remember, this is not a treatment or replacement for emergency care. Think of it as a bridge while help is on the way. If you find the drink too spicy, having a spoonful of yogurt or a little milk will help calm the burn without reducing the blood vessel effects. A key point: never substitute chili powder blends for pure cayenne, as some blends include salt or other ingredients that are not heart-friendly. Now, there is one step that almost everyone knows about, but nearly everyone does wrong. Aspirin. Many people assume swallowing an aspirin is enough, but studies from Harvard have found that swallowing aspirin whole when chest pain strikes can delay its benefits by a full 20 minutes or more. What makes the difference is chewing your aspirin. If you ever have sudden chest pain with risk factors for heart disease, and your doctor has given you the all clear to take aspirin, chew one. 325 milligram regular aspirin, do not swallow it whole, and avoid coated or delayed release forms if possible. Chew it for at least half a minute, even if the taste is unpleasant. Then swallow with a small sip of water. Chewing creates a much larger surface area, so the medicine is quickly absorbed straight through your mouth and throat, lining into your bloodstream. That means it can begin thinning your blood and potentially blocking more clot formation as fast as 3 to 5 minutes, compared to up to a half hour for a swallowed, coated pill. For years, I have seen patients grab aspirin bottles in a panic, only to reach for the baby aspirin, just 81 milligrams. While baby aspirin is excellent for daily prevention under a doctor's orders, emergency use in chest pain typically calls for a full-strength, 325 milligram dose. Chewed. Think of it like putting out a fire. More is needed in the emergency situation. Then your doctor decides what's appropriate for you long term. Saliva produced. While chewing also helps dissolve the aspirin faster, essentially flooding your bloodstream. This is not about breaking the rules if you are already on blood thinners like warfarin or an anticoagulant. In the setting of real chest pain with concern for possible heart attack, studies suggest that the heart protection may outweigh the small increased risk of bleeding. But you must always tell emergency responders exactly what you've taken. Let me share a story. One woman I worked with had chest pain in her backyard and remembered this advice, but her husband was so worried about her blood thinners that they waited 15 minutes before deciding. When emergency crews arrived, the paramedics encouraged them both to remember, in real emergencies, faster action with a chewed aspirin could make the difference between a mild event and a major heart injury. Now, here's a trick that sounds almost too simple to believe, but it is recognized as potentially life-saving in some emergency heart rhythms. What's called the power cough technique. In certain cases, when the heart's rhythm suddenly goes haywire and blood isn't circulating well, a forceful cough every couple of seconds, paired with a deep breath, may help keep blood moving to your brain. It acts almost like a self-performed CPR if you're still awake but starting to feel faint. If you feel sudden severe lightheadedness, palpitations, or the sense you might pass out along with your chest pain, take a deep breath and cough strongly and deeply using your chest muscles, not just your throat, about every 2 seconds. Breathe, cough, keeping a steady rhythm. This increases the pressure in your chest and can squeeze the heart and major vessels, pushing vital blood up to your brain and possibly jolting your heart back toward normal if it is a specific type of dangerous rhythm. Studies in cardiac labs have observed that this technique may help people remain conscious a minute or more longer if the heart suddenly drops to a dangerously slow rhythm or into certain abnormal patterns. However, cough facilitated CPR is only helpful when you're already losing consciousness with ongoing chest pain, and there is no one else to help. If you are alone and feel yourself losing alertness, try this technique as you call for help. Once you lose consciousness, though, cough CPR is no longer possible, and standard CPR from another person becomes the only hope. Finally, the step that many people get wrong simply because of when and how they use it: the nitroglycerin protocol. I've seen countless older adults hesitate to use their prescription nitroglycerin tablets or spray, hoping the pain will just fade. But nitroglycerin is most protective when used at the very first sign of chest tightness, pressure, or significant discomfort, not after waiting to see if things get worse. If you are prescribed nitroglycerin by your doctor, keep your tablets or spray somewhere instantly accessible: nightstand, wallet, car, purse. At the very first moment you feel chest tightness or pain that could be heart-related, sit down safely with your feet on the floor or gently elevated, and place one tablet or spray under your tongue. Do not swallow it. This is critical, as under the tongue or sublingual tissues absorb the medicine directly into your bloodstream in under a minute, compared to 20 or more minutes by swallowing. A common mistake is hesitating or taking nitroglycerin too late, which can mean higher risk of permanent heart damage if the problem is a blocked artery. If the first dose does not bring clear relief in 5 minutes, you can take a second dose, again sublingually, still sitting or lying down safely. You can repeat this up to 3 times, at 5-minute intervals. If after 3 doses in 15 minutes, the pain is still present or worsens, call 911 immediately if you haven't already. You may feel warmth, throbbing in your head or a mild headache, or even a flush to your face. These are classic effects of nitroglycerin working to open your blood vessels. And if you happen to use a spray, remember it typically lasts longer and is more stable in storage than tablets, which may lose potency after being opened or exposed to light. Some people are worried about taking someone else's nitroglycerin in an emergency. While routine sharing of prescriptions is not advisable, in a genuine chest pain emergency when time is critical, the main real risk from a single use is low blood pressure, which paramedics can often treat easily compared to a fatal heart blockage. If you do use someone else's nitro while waiting for help, always tell emergency responders what you have taken and why. The sequence of these 6 steps is less important than acting quickly and calmly. If you have nitroglycerin available and your doctor has advised you how to use it, reach for that first. While beginning the tripod breathing and chewing aspirin as soon as possible, use cold water and the power cough only as needed based on your symptoms. These steps are bridges, not replacements for emergency care, but sometimes they buy just enough time to prevent a tragic outcome. The bottom line is this: heart emergencies rarely come without a warning, but the warning can be quiet, disguised as a little tightness or a strange kind of heartburn. The people who keep their independence, avoid losing years of healthy life, and return to their own homes after a cardiac event almost always have someone nearby who knows these simple steps. These are actions you can learn right now and share with your family. I encourage you to have these strategies written down and then talk them over with your loved ones. Practice the tripod position. Make sure your aspirin and nitroglycerin are where you can reach them even at 3 in the morning. Try the cold water trick on a calm day so your nervous hands know what to do if you ever need it. Show your spouse, a neighbor, or your adult children this video and talk about what you have learned. If you found this information helpful, please subscribe for more step-by-step guides tailored to keeping you and your loved ones healthy and independent as you age. Share this with anyone you care about, and check out the next video for more tips on staying strong, resilient, and prepared for whatever life brings. You never know the knowledge you gain today could save your life or someone you love.